I'd like to welcome Perry Gottesfeld up to the stage. Perry is an expert on lung diseases that occur in the mining sector relative to all of the things we're talking about. And he's going to be talking about these things for us now. He's the Executive Director, OK International. Did I get that right? Because I'm not looking at my notes, Perry.
Thank you.
Okay, I'm Perry Gottesfeld with Occupational Knowledge International. We're a nonprofit based in San Francisco, but we work exclusively outside the U.S. in low and middle income countries to build capacity around occupational and environmental health. And we're an unusual NGO or nonprofit in that we work both at the village level to implement protections and improve practices to protect individuals' health, but we also work on the global and national level to influence policy, and that means sometimes working with industries and get them to change their practices by hitting them over the head often. So this is such a refreshing place for me to be with this group of folks that come together to invite their critics and their friends to really shine the light on this industry and see how we can work together to seek improvements going forward. So I salute Susan and the organizers for inviting me today. And I'm going to be talking a little bit about overview of the public health impacts throughout the supply chain, the jewelry supply chain, and then I will focus on some of our projects and offer some solutions. So we're going to turn the clock back 100 years, 1919. This article appeared in the Public Health Reports, which is the precursor to today's MMWR put out weekly by the Center for Disease Control. And they reported in 1919 very high incidence rates of tuberculosis amongst jewelers in the US. So I know there's a few jewelers here. Tuberculosis is an infectious disease. Why would jewelers have higher rates? Stumped you, huh? Okay, silence. Well, it turns out that they knew at the time that the incidence of tuberculosis is linked to dust, including silica dust and metal dust that's present in the workplace. And something tells me in those days the jewelers were also doing the stone cutting and polishing here in the US and weren't relying on India and the Philippines to make that happen. But in any case, some of the younger groups of jewelers had more than twice the levels of tuberculosis than other occupations, and this was a serious linkage that was well known at that time. But it's not just jewelers, of course, that have risks in their workplace. It's the miners, the stone polishers and cutters, as well as the goldsmiths. And all of these are exposed to silica dust on the job. Of course, miners have the highest exposures, and the processors have the highest exposures. But if we look at things like diamonds, sometimes the rock is associated not just with silica, but also with asbestos. This is particularly true in South Africa. And then, of course, as you heard lots of today, mercury is added in the process of refining the gold, and of course that's a huge hazard, as is the cyanide, which is used as well. Other metals are often present along with the gold, and those metals could also be very hazardous. And then we have noise and safety hazards as well in the mining industry. For the cutters and polishers, the number one risk is from silica dust exposure. And tomorrow you'll hear from Jagdish Patel, our partner in India, who's going to talk more extensively about this community he's worked with for almost 30 years, who've been extensively exposed and have come down with very high rates of silicosis and TB as a result. And as far as the jewelers are concerned, of course, there are solvents that are used. Silica is sometimes present in chalk molds. Talc is sometimes used. Those who work with seashells should be aware that these also have high levels of heavy metals. Other contaminants are also often present or introduced to the metals themselves, including cadmium, cobalt, beryllium, lead. And then acids are often used, sulfuric acid and others. And all of these groups have been known to have higher rates of tuberculosis. So silica dust exposure is a serious public health issue around the world. Silicosis, the resulting disease, is one of the most common occupational diseases around the world. It's also a well-known risk factor for TB, and we know that from formal sector mining, those individuals have 3 or 4 times greater risk of coming down with TB than do others in the background, in the same countries in the same background. So it's important to also note, though, that it's not just silicosis or tuberculosis, but there's a combined disease of silicotuberculosis, which has been well understood for at least 100 years. And this is not some exotic or rare exposure. This is the most common element in the earth. So wherever you have mining, gemstones, you're going to have silica dust exposure. And what you're looking at here is gold processing. So TB is the greatest public health challenge of our times. More people are dying from this disease than any other infectious disease. Every year, about 10 million people become sick with active TB, and it is a disease that's commanding about $7 billion in investment annually. However, all of that money is going into case identification and treatment, and none of this is going into prevention. But to be fair, there are other known risk factors for tuberculosis, and these include things like alcohol use, diabetes, indoor air pollution, malnutrition, HIV, but we know that the #1 risk factor, relative risk factor, is for those who actually have silicosis. But you don't have to have silicosis, just silica exposure to have increased risk. And this has come out in numerous peer-reviewed scientific literature articles that have looked at gem and cutters and polishers in countries around the world, including India, Iran, Sri Lanka, Hong Kong, Brazil, and China. Have I skipped anybody's supplier? All of these countries have, all of these workers have been known to have higher rates of silicosis, lung disease, and tuberculosis. And this has huge implications for your industry because we know that about 90% of the world's colored gemstones are sourced from low and middle income countries. The great majority of these come from artisanal and small scale miners, and the U.S. is importing about $2 billion of colored gemstones a year. So this is a big, big industry. Similarly, for gold, we know that U.S. mine production has remained stable over the years, but it only accounts for about 10% of the global production. And jewelry represents about half of the demand for gold, half of the current demand. And we know then that U.S. jewelers are going to be dependent on gold imports for the long haul. And this is often what it looks like. And this is something that is relatively new. It's something that's really cropped up in the last 10 or 20 years, the proliferation of small-scale gold mining. Along with the increase in the price of gold over the last couple of decades, this industry has boomed. And today there's 6 or 7 times more artisanal small-scale miners than there are people working for large industrial mines. And employment in large-scale mining is declining, whereas this is a boom industry, a growth industry in over 70 countries around the world. So this is something like 40 million people that are directly employed in this industry, and that's just a rough estimate. And we know that they produce something like 20% of all the gold, 25% of tin, produce about a quarter of the tantalum, and about 20% of all diamonds. And you could add cobalt to the list and others. So my story today begins here in northern Nigeria. This is a extremely dry area of Nigeria. This is an area that has very little income opportunity outside of the short growing season. It's also an area that has some of the highest malnutrition of any area in Nigeria, some of the highest poverty statistics, and it's also, and it should be no surprise, one of the most insecure areas of Nigeria with high rates of kidnappings and other crime. But it's also in this area of northern Nigeria that the world's worst lead poisoning outbreak has been recorded. And it's the worst because of the great number of people who've been poisoned, but it's also the worst for the high, very high exposures that we've never seen anywhere else in any other industry, in any other context in the past. And Doctors Without Borders was doing just some routine medical vaccinations in some rural villages in northern Nigeria in the Zamfara state in 2010 when they stumbled upon this. And in some of the villages they had visited, about a quarter of the children under age 6 had just recently died of unexplained deaths. And with to their credit, within a couple of weeks, Doctors Without Borders was able to isolate the cause as being lead poisoning. And this was immediately linked to the gold ore, which contains up to 10% lead in this region of northern Nigeria. And then they found this in Zamfara state. Some years later, a second outbreak occurred in the neighboring state of Niger. And since then, we've known that hundreds of children have died from acute lead poisoning, and thousands more have been treated and have been kept alive by Doctors Without Borders efforts in this region. But we know that being kept alive with the treatment for lead poisoning is not a cure. These children have severe brain damage. They will be severely impacted for the rest of their lives. They have other health impacts linked to this poisoning. And it's a revolving door. What Doctors Without Borders found is that, of course, new kids are born, new kids get exposed and come into their clinics poisoned. And in recognizing that there was no medical strategy that was going to get them out of this hole, they turned to prevention. And we partnered with them since 2016 in implementing safer mining practices to reduce exposures amongst the workers, but also to reduce the take-home exposures from the mines to the communities. And to show you where this lead belt occurs, it's in the red circle area of northern Nigeria, and it's the gold ore in this whole region has very high levels of lead. And several states are impacted, and thousands of villages where gold mining is taking place, but we know that we're only touching a small part of this, even with the resources that have been brought to bear to date. So when we started in introducing safer mining practices, at that time, Doctors Without Borders had never really worked with the miners. They had worked with the children who were poisoned, and usually the parents, the mothers, who would bring the kids to the clinics. And so when we said we were going to go talk to the miners about working cooperatively on safer mining, they were like, good luck. You know, we don't even know if these guys are going to talk to you, but good luck. So we showed up with our translators, and we met with the mining leadership, village leaders, the religious leaders in this area, because it's a very highly Muslim area. And we said we want to help you and work with you in introducing safer methods. And the first question that came back was, are you guys here to mine gold? And I turned to my translator and said, let's try this again. I said, we're here to work cooperatively with you, if you would like, to introduce safer mining methods, and if you could maybe try to explain it. And he translated, and we came back with, okay, so you're here to buy gold? I said, no. And it wasn't a problem of translation, I could assure you. It was just such a foreign concept that anybody was actually coming to help them and work with them on this issue. But it also brought to mind that we had a big education challenge ahead of us, and so we trained miners. That was how we started, explaining the hazards, not just they had seen their cattle die, they had seen their children die, but they really didn't understand that this was having an impact on their health as well. So we brought them in groups of 20 and 30 and trained them. To date, we've trained more than 2,000 miners in this region. And then over time, we built trust and gained their cooperation to the point where they were very willing to work with us and to make changes in their practices. So for those of you who are unfamiliar with the gold mining process, the rocks are brought in from the mine, and in the process, of course, dust is released. And then these rocks, these large rocks, are broken into smaller rocks about the size of a fist, and then mechanical processing usually takes place. These are grinding and crushing machines, and until you have created a material about the consistency of flour. And that's what these kids are showing me here in the top right-hand photograph. Very fine, very dusty material. And then the process is converted generally to a wet process. And we're using either washing or panning or sluicing, other gravity methods to concentrate that material, keep the gold and get rid of the other materials. And the final part of this is you throw a little mercury in. And we've heard a little bit about that today. And of course there's hazards from burning that mercury in terms of the airborne emissions, but also the dumping of those tailings into the environment. But it is my contention that the far greater health hazard is the part that gets no attention at all, which is from the metals that are in your ore and the silica dust, which is always going to be present in gold mining. And this is what it looks like on the ground. Sometimes it's open pit mining like you see here. Sometimes it's underground shafts that are dug. Some significant safety hazards there for sure. And then the processing, and this is mechanical processing taking place out in the bush in order to create this very fine material. And you can see the very high exposures as a result. So the first thing we did is some air sampling to look at both lead and silica dust exposures, and we looked at groups of miners, we looked at those working in the processing sites, and we found that the miners had lead levels, lead exposure levels about comparable with the U.S. permissible exposure level. It's not a safe level, not a good level. That dates back to the 1970s. We've learned a few things about low-level lead exposure since that time, but OSHA's not going to change. But we found that the processors were exposed to about 8 or 9 times higher exposures than the miners themselves. And this was particularly troubling because most of the miners spend part of their day at the processing site when the ore is brought up and ready to be processed. So we knew we would have to focus on that as a key exposure. But we're talking about an area that has no electricity and no running water, so the first thing we had to do is put in a bore well in order to convert this dry process to a wet process. And then we told the miners that we would be willing to invest in this bore well, but we wanted them to also invest in the process. And so they put up the funds for the gasoline-powered generator that would then pump the water up from the surface, from the bore well to this tank. And we built this tower, and it might not look like much from the perspective of downtown Chicago. But I can assure you this was by far the tallest structure within 20 kilometers of this particular site. In fact, the first mason we hired quit after we got to 3 meters and never showed up again. Later we learned he was afraid of heights. But we needed the height because we needed to have pressure on the water in order to feed these specialized water spray misting nozzles. And these nozzles are intended not just to get everything wet, but to create a very fine mist in a cone-shaped pattern in order to trap that dust at its source. And then that's showing the installation close to one of the crushing machines. And in addition to the wet practices, we also did some of the simple things. So we noticed that the food vendors were coming in to sell food right in the middle of the mines and the processing site. So we constructed a shaded eating area away from the work area, and that's what you see in the center photograph, so that the food vendors could congregate there and the miners could go there and have lunch and breaks and so forth. So some of this is really simple stuff. Getting workers to not take their clothes home so that they don't contaminate their children. And then that they would have changing facilities at the mine sites and at the processing sites, separate eating areas. Hand washing is very key. And that they also don't track it home on their shoes, and clothing is essential because a lot of this is take-home exposure. And we also established health and safety committees in all of these villages so that we would have a sustainability mechanism for somebody to report back on a regular basis about what's happening out in the fields and in the mines and where they're seeing challenges and where they're seeing good cooperation. And that's been a very effective mechanism going forward. And then we came back and did air sampling after these improvements were put in, and we found a 95% reduction in airborne lead levels, about an 80% reduction in the respirable silica dust. The difference being that total lead is measured when you look at lead, but when you look at silica, it's the very, very fine dust, a lot more difficult, of course, to trap and retain. We published this earlier this year. But when we look at lead poisoning, the gold standard, if you will, is blood lead testing. So we convinced Doctors Without Borders, since this has never been tried anywhere, we convinced Doctors Without Borders to let us look at a random group of 50 to 60 miners and have them tested every 3 months for a year and a half. And we monitored their blood lead levels and found that over this 19-month period, we were able to reduce their blood lead levels by 34%. And this is something that large lead-using industries spend millions of dollars to do. And we did it for a capital investment of around $5,000 in this group of villages. So you've already heard a lot about mercury, and I wanted to show this to say, well, this is the size of the container of mercury that the average miner or group of miners is using up on the top left. And normally this is used after the material is concentrated in a pan, and that's what you see on the top right. But sometimes it's used with whole ore, and that's what you're seeing at the bottom left. That means they're throwing it in with water, with a whole pile of ore and mixing it up. And of course, that's the worst practice because a lot of that material is going to be dumped into the environment. The end result is you have a little speck of gold attached to that mercury, and that's the material that we talked about burning today. So this has been extensively studied in groups of miners around the world. More than 100 publications have come out in the scientific literature on this. And we know that airborne levels are on average about 5 times greater than the occupational limits in the US. And about a quarter to a third of these miners are suffering from a range of symptoms which all fall into this sort of chronic intoxication, mercury vapor intoxication, which is sort of a mixed bag of symptoms. But the good news is that there's no evidence anybody's dying from this exposure. It's a huge environmental problem. It is estimated that about a third of all mercury emissions to the environment are coming from this source. But that's somewhat comparable to what's coming from large-scale smelting around the world, which is not just gold, but all metals. So that's to put this into perspective. But nevertheless, this group of informal miners is one of the key targets of the Minamata Convention that you've already heard about today. There are, however, substitutes for mercury, including borax, which has been used in the Philippines for a very long time and has been shown to be effective in at least a dozen countries around the world by our partners who are based in Denmark. But there's other methods that have been tried and used, gravity concentration methods, and we know that it's possible to do this without mercury. And cyanide is usually used for large-scale mining to leach out gold, but it's also something that we do see in artisanal mining as well. And this is a pond that is built up and created for the purpose of leaching out the additional gold in this ore. And the cyanide is put into a solution, and that's leached through this material, and then the leachate is collected on these aluminum plates which trap the gold. And that's unfortunately done often with tailings that have already been treated with mercury. And so this has serious implications for environmental contaminants. Biggest concern with cyanide is contamination of drinking water. There are some health effects for extremely high exposures, chronic exposures over time that include brain damage and heart and coma and even death, but that's quite rare. It's a much, much lesser hazard than mercury is, except when it is used with the mercury treated tailings, or then you get the release of methyl mercury, which is the most available form of mercury getting into the environment. So we know that there are, to my knowledge, at least 4 certification programs for gold. And the question now is, which ones address these hazards? Well, all of them talk about mercury, but none of them require the elimination of mercury. They talk about managing mercury, they talk about reducing mercury, but none of them talk about eliminating mercury. What do they say about silica dust? Nothing. They're all silent on silica dust. There's one of these, the bottom one here, that talks about dust, total dust, but nothing specific about silica dust. So we have a long way to go in improving certification efforts if we're going to address the greatest public health challenges in the supply chain. So in taking this forward, I would say that we need to definitely look at dust controls because we know these work. We could prevent silicosis, we could prevent tuberculosis by investing in this. And it's not rocket science, it can be done. And unlike the controversy around eliminating mercury, it doesn't change the yield or reduce the yield to the artisanal miners. And we know that dust controls are more cost effective than investing in public health programs to identify cases of tuberculosis and to treat those individuals. And this is becoming even more true with the higher numbers of multi-drug resistant cases, where the costs for treatment go from a few $1,000s to tens of $1,000s per individual. And that's even without considering the co-benefits here of reducing silicosis, lung cancer, which is also associated with this exposure, as well as other silica-related diseases. So knowing that the United Nations was having its first ever global meeting on tuberculosis at the General Assembly last year, I took this issue to the International Commission on Occupational Health, and we put together a position statement that was then published last year, calling for the prevention of tuberculosis among silica-exposed workers. And we asked for investments in reducing exposures to silica in order to lower TB risk, lung cancer risk, and silicosis risk. We also said that dust controls should be incorporated into any efforts to address mercury in small-scale mining. And then we took it to the United Nations, where we were fortunate to get the support of a few of the countries to put in specific language into the declaration that specifically highlighted this issue to countries, and it actually committed countries to implementing primary prevention in high-risk occupations by reducing silica dust exposures in mining, construction, and other dusty workplaces, and worker tuberculosis surveillance and infection prevention and control in healthcare settings. And this was a huge win for us, and now we're trying to take this forward and getting action by the global funders. So steps forward and how we need your advocacy to help us take this forward. Well, first of all, as I mentioned, we need to strengthen these codes of practices and certification. In the case of gemstones, there are no codes or certifications yet, so we need to look at that issue for sure. We need to strengthen national regulations, which is going to require advocacy, and we need to build capacity to enforce regulations in countries around the world. But where there are formal sector workers, we need to make sure that those workers are compensated, not just for silicosis, but when they get tuberculosis or silicotuberculosis, which is rare in most countries around the world. And of course, we have to strive for mercury-free gold mining. But I want to encourage all of you to also advocate these issues with the global health community, because as I mentioned, there's a huge investment being taken place by the US government, by large foundations, the Gates Foundation and others, but they're totally ignoring this issue of primary prevention. And we know that we can do this, but we need support to take this issue to them and encourage them to invest in dust controls in these industries. And we need to focus on workers with the highest exposures first, particularly in countries with the highest rates of TB and the highest HIV burden, which are primarily in sub-Saharan Africa. So some conclusions. First, miners do care about their health. And that might sound trivial, but often when I talk to people here about the issue, they say, well, nobody cares about that in those communities. They say, well, no, often they're uninformed. And when we work with them, educate them about these issues, they're willing to invest their labor, they're willing to invest money to making these improvements. And it is possible to significantly reduce exposures to lead, mercury, and silica dust without destroying the underlying economics of this activity. And so whenever we're dealing with the mercury, we need to also focus on the greater hazard of silica dust. And prevention, it's not very popular amongst global health funders, but it is very effective. Thank you.
Mike, you got a mic like Beyonce if you want to be heard.
So first of all, I want to say Terry and I, and actually Pure Earth, which was Blacksmith at the time, this is what I came to when I worked in, my first day on the job was this. It had just happened, and it was U.S. government money. We're the ones who paid for this. The U.S. government paid for this. And if you actually can go back a few slides, and I'll show you what happened, what actually was the precipitous of if you want to show back, there's a slide where you have the machine. So what happened was mysteriously, these food grinder things showed up in these villages. And all of a sudden, that's when the lead poisoning crisis started, because it broke up the not only the gold was burning in lead, and it broke up the exposure to lead, and what he also actually all Muslim, and they live in these dirt villages, as you can imagine here, and the women were doing it. It was in their little compounds. They live in these dirt circular compounds, and it was the women's job to do the lead breaking up and the washing and things like that. And then all these kids, because they have 7 to 6 to 7 kids per person, and the children eat dirt. So it wasn't necessarily the men coming back from the mines. It was a little bit, but not as much as it was the breaking up of lead in the food grinders, which they also did for food. And it was actually CDC and Perry and we hired them to do all the work. We got an OFTA, which is a Declaration of Disaster Relief, and we paid to have 7 villagers remediated, which is the ones that are mentioned here, including Begega, which is was the largest. One thing I can say though is that we did tell people started having miscarriages and pregnancies or losing their children to death. We paid to have children chelated for lead poisoning. So actually, I spent months up in my time up in Zamfara. Part of the first time I was up there, we spent months going and testing children under 5 to see if they were poisoned by lead. And they don't know their ages, so you have to go like this and say, can you do that? Because if you're over 5, you can do that. And the rates of people's lead exposure was beyond what is survivable. And it's $1,000 a treatment for chelation. And the children would go to chelation, and Medicine Sans Frontiers did that for us. But it was...
Thank you so much for this really illuminating talk. My name is Donna Bilak. I'm a historian of early modern science and of jewelry history and technology. And I want to go back to your point about miners caring about their health. And I wanted to ask you, what are some of the ways in which they treat themselves? How do they understand what's happening to their bodies, and what are they doing with what's available to them to try and protect their health or maintain their health? And then the coda to that question is, after you and your work with Doctors Without Borders, having done the tests that ended up reducing the lead content in their blood by, I think you said 36% after X amount of months, what was their reaction? Did they express to you or share with you differences in how they felt, or surprise? Or I'd like some more insight about what's going on in their minds and in their bodies. Thank you.
Certainly. Well, I think the key is that people need the education in order to better understand the impacts. When we talk about lead exposures, the health impacts are quite subtle and often associated with other illnesses. So it's very hard to decipher what's being caused by lead or what's other illnesses. But they include things like abdominal pain and, of course, memory loss. And, of course, for children, it's significant brain damage and their ability to perform in school, or behavior function is also altered. But I should note that even when we reduce those exposures, the average exposure in this group of miners was still 25 times background levels to individuals in the U.S. So it's still a significant exposure. Nobody said they felt better, nor could they at that level. But certainly we reduced the really high exposures, the adults whose levels were over 100 micrograms per deciliter, which is approaching the level we were concerned about for causing significant acute health effects and potentially death.
Yeah, I want to ask, in Nigeria, since how long this is going on? And you introduced wet methods, which reduced considerably the dust levels. But what is the availability of water? And since it is so simple, why for a long time that did not happen?
Right. Well, although this problem has been going on a long time, it wasn't recognized until 2010. There was some spattered gold mining always going on in these communities, but it really took off about 15 years ago with the price of gold. So then it became a much more common activity. It was then that this became apparent. And yeah, water is scarce in this environment, but it's available, and it's really the only way to really tackle this problem. So that's where the need for putting in a bore well is concerned.
Hi, over here. At the beginning, you talk about how there's also contamination inside the studio for jewelers.
Sorry, contamination of what?
Like this same contamination, but it happens inside the studio for jewelers, people who actually make jewelry in the U.S. I know, for example, that the polishing stones have silica, and there's some alternatives now for some that are made in England. Luxie doesn't contain silica. Hello. Cadmium and lead and other substances. Do you know about how this happens, or some of the things that we can be aware of?
How does what happen?
Yeah, because you talk about minings and
Yeah.
how is that people are being contaminated inside the mine, the workers. But you also talk about how this happens in the U.S. and in other places for people that actually make the jewelry.
Yes.
So do you know how this happens inside the studio, or how to
Are you
avoid
asking
it?
how the
Yeah.
No, for jewelers, like like
mean
yeah,
So you're asking what the exposure risks are for jewelers at the bench?
right.
Okay.
Okay, gotcha. Well, there are smaller amounts of contaminants that are present in the gold, or other metals, or sometimes used in conjunction with gold. That's certainly one issue. But some of this is historical, where jewelers were, in the U.S., were actually polishing and grinding and cutting themselves. I don't know if that still happens sometimes. And then certainly we said there's other materials that you work with that are other hazards that are present, like sulfuric acid, for example. It's a range of different exposures, for sure.
Hi, Perry. I wanted to first thank you for your years of raising this topic. I remember listening to you 4 years ago, or 3 or 4 years ago in DC, and it was based on that speech, which is very similar to this one, that woke me up about dust. And I wanted to let you know that we've actually incorporated dust awareness into the GIA education training, which we're aiming to reach 10,000 artisanal gem miners in the next 4 years. So I wanted to thank you and tell you that your education is going to action in other parts of the world as well. So thank you. Yes.
1.3 million program for
Correct.
education?
Yeah, correct. So 1.3 million. Thank you, GIA. Okay, here. So it's about education about health and safety. So I want to credit you for picking me up, and so we can reach more minors. My question is, I saw a lot of. I saw a lot of ladies. Thank you. I saw a lot of ladies in those slides that you showed processing, in dusty conditions and with mercury. And so my question is, with your program in Zamfara, can you talk a little bit about reaching both men and women and differences in that and different exposures and risks based on what they're doing?
The exposure risks to mercury or to in general?
Both to mercury and silica dust.
Okay. Yeah, well, certainly, depending on where in Nigeria, we've seen women and men mining in one state. The next state over, it's exclusively men. So that is one huge difference, that even within a small geographic area that we've seen. And then, as mentioned, women are also involved sometimes in processing. Well after Betsy was involved, the processing has all been moved out of the villages, but lead poisoning has not stopped, unfortunately. But women are more susceptible to the effects of mercury and lead. And our study on lead showed that they had higher levels than the men. And then they also, their reduction was less than the reduction for men over the same period of time. So this is a serious problem for women in this community, for sure.
Great, thank you. My name's Katie. I work with Christina at PACT, but on the impact investing and alternative finance team. So I'm really interested in how we can bring more financing to these great solutions that you're coming up with. Could you talk a little bit more about the economics? I know you mentioned on your conclusion slide that there was a way to implement these solutions and not overly change the economics. So how do the costs compare, and what did you see in terms of production for the miners of the gold?
Well, this doesn't impact production per se, unless maybe you could say that the gold was flying away in the wind, which it was, and now they're able to trap it close to the process. But it is really, I think, a question where we said we invested around $5,000, but this protected maybe 450 to 500 miners who were all reliant on this processing site and spend a portion of their day at this site. So I think it gives you some sense that the economics are not destroyed by a small investment. And certainly this could be replicated.
My name is Hewan Zode. I'm from Gems of Ethiopia. I would like to say, first of all, thank you for the information to bring out. This is going to create awareness for us who are sourcing down the ground from the miners, as well as the foresting. And I'll say, since this is a major global issue, silica, the TB, all this crisis and defrosting, I think the major one thing we all need is to create awareness for the miners and education. This is like a prevention. If any kind of crisis happen, like she said, say US government mostly fund the UN and most of the health cares. And what we need is, as in like most developed countries, they don't care about for them having a disease. It's gonna cause them some kind of health issue tomorrow or after 2 years or not that. They care about eating daily just to survive for a day. And they do this to survive. So as we all need is like, we need to create a kind of like through Department of Health, through Department of Ministry of Mining, where those are countries who have a higher risk of TB and like silica problems and for defrosting, to create some kind of educational or awareness for the miners and also for us to know and to help on that department of like whatever they're, what I'm saying is to create a kind of like awareness and education for the miners. They need that, and we don't have that in most countries. And they care about surviving in one day.
Right. Well, I agree that more needs to be done to raise the education and awareness. And knowing that many governments are investing in implementing the Minamata Treaty, I keep harping back on those who are working around mercury need to incorporate this message into that work as well, because it's an opportunity. It's also requiring countries to come up with plans for how they're going to implement Minamata and looking at training miners and the like, and those should be incorporated into these national plans under that treaty as well.
Okay, that is a wrap for this morning. Thank you very much, Perry. This was great.